Now on Local 5, contact tracing and why it is so important in the fight against the coronavirus. Good evening. Thank you for joining us. I'm Tom Zaleski.
And I'm Erin Davis. And fighting the coronavirus depends on two things: learning who has the disease and who could get it.
And as Chris Schuler reports, in this pandemic, it's the job of contact tracers to find out who infected patients may have had contact with.
According to the Wisconsin Department of Health Services, there are now over 900 positive cases of COVID-19 in Brown County. But according to Dr. Ashok Rai from Prevea, without the ongoing efforts of contact tracers, that number could be higher.
Given the sheer volume of people that they've been handed and the fact that they have been contact tracing, like I said, they really are the unsung heroes here in town right now.
Contact tracing is a tool for public health agencies to gain control over a public health crisis. The job of contact tracers is to work with those who've tested positive and then determine who they've come in contact with.
You know, where they work, who they've been in contact with, who lives in their household with them, where have they traveled, how may have they contracted this, and who they may have spread it to.
Rai says with that information, these medical detectives track down those most at risk, passing on quarantine or testing instructions to hopefully stop the infection in its tracks.
You're looking at trying to control something that you don't have control of.
Governor Evers has announced 1,000 more contact tracers will be hired as the state ramps up testing to help reopen many services in the state. Dr. Rai says they are a critical component to live with COVID-19, which for now isn't going away.
Every time we have a positive, the more contact tracing we can do and the more quarantining of small populations we can do, the rest of the population can get back to, phasing into a new normal.
In Green Bay, Chris Schuler, Local 5 News.
Thanks, Chris. Contact tracers in Brown County include retired nurses, doctors, as well as staff from the Wisconsin Department of Public Health, Brown County Health, and the CDC.